Hello. Welcome to our discussion on women's health. I'm Cherry Brandstater. I am a family medicine doctor with Beaver Medical Group, and I've invited a couple of my favorite colleagues to join me today in this discussion.
I'm Dr. Bennett-Stewart. I'm one of the OB-GYNs in Redlands.
And I'm Dr. Darlene Rae, family medicine in Beaumont.
So when we talk about women's health, Dr. Rae, what things should be addressed in women's health?
So I see a lot of women out in Beaumont, and all the family doctors do. And really the idea for them when they come to see me is to get to know me, to have somebody as a resource, and really to go over just general health. And depending on the decade of their age, if they're younger, we're dealing with different issues than if they're older. But really, women and men's health is very similar as far as blood pressure, cholesterol, cancer screening, preventive health care. They're very, very similar.
And Dr. Bennett-Stewart, what is unique to women with respect to preventive care?
Doing mammograms, Pap Smears, cervical cancer screening, addressing reproductive issues, menopause, contraception.
There are so many topics that we could discuss, but I've chosen two specifically to kind of hone it down to something we can manage in our short period of time. And I've chosen those on the basis of how many changes have taken place in the last few years. Pap smears and mammograms. So could you go over some of the guidelines for Pap smears?
Current age that we recommend Pap smears starting are at age 21. And then from age 21 to 29, doing Pap smears with cervical cancer screening every 3 years. And after age 30, considering doing either just a Pap smear alone every 3 years or Pap smears with HPV co-testing every 5 years.
Some of my patients are actually fearful about waiting 5 years to get a Pap smear. What is that based on?
In the past, we used to do Pap smears every year because that's what we thought was best. And now that we're finding that most abnormal Pap smears are caused by the HPV virus, and what we're finding that even if you have an exposure to HPV virus today and say you develop an abnormal Pap smear, it may take at least up to 10 years before that abnormality will cause a cervical cancer. So testing at 3 years or at 5 years, we would be able to pick up a change and treat it before it would ever progress to cancer.
So the current guidelines are actually pretty conservative.
Yes, I agree.
So why do we not start testing or doing Pap smears before the age of 21?
At ages less than 21, many of our patients may be becoming sexually active. They may be exposed to HPV. They may have abnormalities that develop, but most times in that age category, those changes are going to clear up, and actually the HPV can actually resolve on its own within a year or two without treatment. If we're screening those individuals, we may be getting results that we may be doing interventions and treatments that may be unnecessary because they may be things that would have resolved on their own.
Right, adding an extra burden to the patient that's really not going to benefit them or be beneficial to them. You've talked about the women who are between ages 21 and 29.
Yes.
Is there additional testing besides the Pap smear that they should get during those years?
So we also do recommend screening for sexually transmitted infection, most notably chlamydia is one that we routinely will do with the Pap smear screening for those women that are in that age range. Also, if the Pap smear does come back abnormal, we do add an HPV test to see if that person has been exposed to HPV, to see if the abnormality on the Pap smear is something that we need to be concerned about.
I know from talking with some of my other colleagues that there's also another recommendation for testing for chlamydia that we haven't always been so good at doing, and what is that?
Starting the screening for the teenagers, I believe, like around age 16. And I believe we're actually doing it all the way up until age 29 routinely for our patients, which hasn't always been done. Yes.
And one of the pieces of good news for the patients is they don't have to have a Pap smear in order to get that done. So we start the Pap smear at 21, but a 16-year-old doesn't have to have the Pap smear. How is that tested for?
It can be screened on the urine as well.
Okay. Let's move on to the mammograms. That's another area of flux and a lot of change within the past few years. And I know not all of my patients are terribly comfortable with the changes. I know there's more than one guideline. Dr. Rae, would you go over what some of those guidelines are?
So you're right, there are different guidelines, and years ago we actually did a baseline mammogram at 35, so some of the older ladies may have actually had a mammogram back at that young age, so they may be giving this information to their daughters and granddaughters, which is actually no longer the norm. So normally we start doing the mammograms at 40, and in general we're going to be doing a mammogram every 2 years up until when we stop doing Pap tests, which is about 69. Many women will continue until 70, 74. So between 40 and 74, we're normally doing a mammogram every other year. That's kind of a combination of all the different guidelines. We have the cancer guideline, the gynecology guideline, the family medicine. I'm family medicine, so we go with every 2 year, but the other guidelines have some variations on it.
And all of the guidelines are quite conservative. They're not leaving the women exposed because an insurance company is making the determination. One of the things I like about the American College of Gynecology's recommendations is something that they call shared decision making.
Yes.
Can you just expand on that a little bit so that the patients understand that?
So with all my patients, I will, when they come to me for their well woman exam, they'll ask me, am I due for a mammogram or am I due for a Pap smear this year? And so usually I do what we call shared decision making. So with American College of Obstetrics and Gynecology, they say consider an average risk woman starting your mammogram at age 40. Now if my patient has her mother had breast cancer or another first-degree relative, then we may decrease that to age 35. In that patient, we may say you probably should have your mammograms every year, but in someone that's lower risk, maybe they could go to wait until 40 and have their mammograms every other year, or they, with the Pap smears, using the current guidelines. Now, if they have something abnormal in their history or they've been exposed to HPV, then that would be something different for that patient, and actually we discuss it and we try to detail it just for that patient specific.
One last question on this topic that I would like to pose to both of you is I have some patients, and I'm sure that Dr. Rae does as well, who feel like the only place they can get a Pap smear is with the specialist. Could you both kind of chime in on that and tell us your views on it?
Well, I think that the patient should be able to get a Pap smear with their primary care provider. As long as their primary care provider feels comfortable doing their Pap smear, I think that's totally reasonable. I think the times when maybe it should be done by a gynecologist is if maybe the patient has particularly difficult anatomy access, able to visualize the cervix, or they've had some surgeries, or if something has come back abnormal with their primary care provider that needs further evaluation by a specialist.
Of course, because there may be further testing to do that we aren't able to do as family medicine. Dr. Rae, I assume you do Pap smears?
Yes, I do Pap smears.
Okay.
And, I don't really have a lot of patients who ask for a specialist, but I'm sort of in a more remote area, so we don't have as much access. And so that is kind of a limiting factor. But I'm very happy to do it, provide that service for them, and sort of a one-stop shop kind of a visit. But certainly, for patients who are listening, would want them to ask their family doctor, their internal medicine doctor, to at least consider doing that Pap test and
save them an extra visit.
Exactly, an
Even
extra
an
copay.
extra copay. Yeah. I'd like to thank you for joining us in this discussion. We think it's important that you become directly involved in your own health care. And we hope that some of the things that we have shared today will encourage you to pursue your own healthy future.